and we might be eating our Big Mac while we're doing that. So we have this serious disconnect. Okay, right, I know what I should be doing. I have all this knowledge, but now where do I go? How do I make those changes? So I'm hoping that you will all take that from this talk. How many of you have said, I don't have time to exercise, or I don't have time to go grocery shopping or eat healthy? All right, so this is one of the most common reasons people say they don't want to exercise, right? I'm too busy. I've got this job, I have a 1-year-old daughter, right? I'm in a position where it's really interesting to talk to you all about, I was a seriously regular exerciser, had my daughter, and now I'm restarting from zero. So I can empathize with all of you who are here, who are starting from ground zero. Having ran a marathon a few years ago, I'm starting over again. So I'm telling myself this as I'm telling you all this. So the interesting thing is, all we have is time. Time is continuous, right? It's how we spend our time. Okay, so think about in your mind, right? I don't have time to exercise. If you change that to, I choose to do something that I think is more valuable use of my time. If you change the way you think about that, that's a pretty significant change, right? And saying, instead of saying I don't have time to exercise, you're saying I don't value that time that I'm spending on exercising. I would rather sit on the couch, right? When you're behaving and sitting on a couch. So think about that. Just frame it a little bit differently. All right, so we're saying, right, I have this pull between, right, I get home from work, if you're maybe thinking about an evening exercise program, the second I walk in the door, I just want to sit on the couch. It's been such a crazy day. My daughter just went to sleep. I just want to sit, right? Versus I really should be stretching, doing some yoga, running, doing some resistance training. All right, so it's again, this push and pull of how we decide to use our time and to be more mindful of how we use our time. What are we doing? If we're sitting on that couch, maybe your show ends, right? Maybe you're watching Netflix or something. The show ends. Instead of clicking play the next show, think to yourself, right? What could I be doing besides sitting here watching my second Netflix show or my marathon? Okay, so these are some kind of general tips that I'm hoping will be helpful to you. So these are all really evidence-based and what a lot of behavioral psychologists will say will be really helpful in helping you start a program and maintain that program. So the first is goal setting. We'll move on and talk about self-monitoring, feedback, and then social support. So first, starting with goal setting. All right, so if my goal is to get back to, I'd like to run a marathon again. That would be fun. I don't really have any desire to do that, but say that's my goal, right? I want to do that again. Okay, that's all well and good. That's my goal. But if you leave it at that, or say, right, I'd like to start an exercise program, period. Well, a goal without a plan is just a wish. You wish to start an exercise program. So what we have to do is think about SMART goals when we're planning for what our exercise is going to be. So SMART goals are specific, measurable, attainable, relevant, and time-bound. Okay, so these are all important factors that will play into how we set our goals. So I'd like to take a semi-realistic example. Okay, so this is Drew Carey from like a few years ago. Has anybody seen him lately? Is it pretty good, right? Yeah? So this is Drew Carey a few years ago. He was diagnosed with type 2 diabetes, and he decides he wants to start exercising as a way to manage his type 2 diabetes. So he's now taking medication for his type 2 diabetes, but he thinks that if I exercise, maybe I can get rid of that medication, right? Exercise is becoming his medication. It's not the actual pill. All right, so he doesn't currently exercise at all. So how can we help change his exercise habits? Let's reflect on our SMART goals, right? We want to set these really SMART goals. So we want to have a specific goal. So he's starting right from ground zero. Okay, I was starting from ground zero not too long ago. I would say to myself, let me work out for 1 day a week for 10 minutes. Okay, I'm going to go for a 10-minute walk, and that's where I'm starting. Okay, so 1 day a week, specific, 10 minutes, specific duration, and also a specific exercise, right? So I have a set specific plan of what I would like to do. It needs to be measurable. Okay, right? So did I complete it or not? Am I able to measure it? So yes, right? 1 day a week, I can check off maybe Mondays are my day. And I want to do it for 10 minutes at 7 in the morning before my day gets started. Okay, and then I can say, right, that I can measure that. So great, got that done. Okay, is it attainable? Right, if I'm starting from 0, I probably don't want to say I'd like to run a marathon in a month. Right, we all probably intuitively know that that's probably not the best idea. We're going to end up seeing Dr. Martinez because we're injured. So not only is it not safe physically, but think about it from a psychological perspective. If I say, right, I really feel confident that I can do 1 day a week, 10 minutes, and I maintain that for, call it 3 months. And I do it every week religiously. Pat on the back, right? I completed my goal. This is fantastic. So it's going to reinforce you to continue and maybe even push a little bit further, right? I might add 5 minutes onto that day. Or maybe, I add on a second day of 10 minutes. Okay, so this could be right at lunchtime, in the morning early, late at night, maybe with a friend or a partner. All right, and so your goals should also be relevant to you. So for Drew Carey, for him, he was thinking exercise is medicine for me, right? If I continue an exercise program, I might actually be able to get rid of a medication. So my ultimate goal is getting rid of the medication through exercise. Okay, so always kind of bringing that to the forefront. Every time he's stepping foot out for a walk or a run, whatever it might be, he's thinking, I'm one step closer, literally, to getting rid of that medication that I don't want to take anymore. This can also be for some individuals specifically looking for weight loss, right? If you're significantly overweight or obese and you're having a difficult time playing with your kids or your grandkids, this could be how you make your goals relevant, right? I want to be able to get down on the floor and get up off the floor in time to catch that little toddler grandchild that I have who's about to put their fingers in the outlet, right? So just being able to make whatever goal you have relevant for you. And then it should be time bound. Okay, so I came out here and saying, I would like to run a marathon. Okay, I didn't say in a month, in a year, 10 years. I have no deadline. How many of you work well without having deadlines? Does anything get done? Okay, it can be something simple like, do you clean your house when nobody's coming over? Right? It could be something like that, right? If we don't have a deadline, we're probably not going to follow through. So again, saying I'm going to work out 1 day a week for 10 minutes for 2 months, and I'm going to see how that goes. And then I'm going to reevaluate later on. So that will get into the next step. All right, so Drew Carey's doing well. He got rid of his type 2 diabetes medication, as far as I could tell. Okay, so next step, self-monitoring. Okay, this sounds kind of icky in some ways. So we can self-monitor in a lot of ways. So what Dr. Bergen was saying, right, she likes to keep a log of all the exercises that she does. That's her way of self-monitoring, saying this is what I was able to do today, here's my plan for tomorrow, and here's where I'm going. So you could do that pen and paper. Some people just like that pen to the paper. There are wonderful fitness mobile applications that are out there that you can also log your exercise. How many of you have heard of a Fitbit before? Okay, so awesome. So that's one way, right? I always get my alert when I'm sitting at my office every hour, right? Get up, walk, and it's a great reminder. That's coming though. So we can log our exercise or our diet, whatever our goals are, and when we log them, we might think about when were we exercising. So Dr. Bergen also talked about this, right? So you might say, all right, I'm gonna try working out in the morning. My 1 day a week at 7 in the morning, I'm gonna walk for 10 minutes. You do that a couple times and you're like, oh, I feel awful, I'm just tired for the rest of the day, yuck, right? So you're gonna record how you're feeling after you do that. But maybe then you decide to switch it up. And you say, all right, I'm gonna switch, I'm still gonna do my 1 day a week, walk for 10 minutes, but I'm gonna try it after work. I have my dog waiting at home. She hates being home alone all day. She's a bundle of energy when she gets home. So 2 birds, 1 stone, right? Exercise for me, exercise for her. It's all great. And that worked well. I felt wonderful. So I'm going to continue and work with working out, at night. Okay, so self-monitoring helps us increase our self-awareness. So in a time of technology and all of us like this walking around campus or anywhere we're going, right, we're not all that self-aware, thinking about what we're doing on a day-to-day basis. That's getting us to the goals that we want to achieve. Exercise, healthy living, right? I think probably everybody in here is thinking, I would like to be healthy. So this is a way for you to be mindful, again, of what you're doing for physical activity, what you're doing to nourish your body in recovery times, and things like that. A great way to monitor your progress. So for Fitbits, right, they'll give you these badges. So it's like a little pat on the back, like, you got your 10,000 steps today, woohoo, right? It's not all that much, but I love when my watch starts buzzing at me to tell me, I'm like, yeah, nailed it, right? So this is great because it's reinforcing you to continue on. It also gives you a wonderful opportunity to adjust what you're doing, okay? If you're deciding, you're hating those morning workouts, this is the perfect time for you to rethink what you're doing. So maybe morning doesn't work, night doesn't work. If you have a lunch hour, you have that value time, right? Instead of sitting at your desk eating or going with your friend to eat, maybe go walk with your friend. That can be really beneficial and helpful. All right, the other thing, while self-monitoring, that I think is really interesting is this idea of stimulus control. So we have lots of stimuli in our environment that pull for different behaviors. And so for folks who like to work out at night, do you ever have those days where you get to the end of your day and you're like, the last thing I want to do right now is go to the gym or go for that run, whatever it might be. A way to control your environment is to say, all right, maybe I'm going to start bringing my gym clothes to work with me, and I change in my office. So I associate those gym clothes with going to the gym. So if I make that small behavior, I'm getting myself closer to the point of actually going. So taking those kind of small steps, like bringing your running shoes with you, changing your clothes in your office, putting on your pump jams right in the car to get you like ready to go for when you get to the gym. Okay, so a little aside, so these are some of the most commonly used fitness apps that are out there. So most people are kind of getting away from paper and pencil, especially when it comes to diet tracking. That can be really, really cumbersome if you're doing it paper and pencil. There are wonderful apps that are pretty well validated for tracking either your exercise or your diet. So MyFitnessPal, who's heard about MyFitnessPal before? A few people. So that's a really, really common one, and one I've used personally with a lot of research that we've done. Nike Plus Training Club is another. Lose It is another weight loss app in particular. And then FitStar by Fitbit, I just found out about this one. It sounds really, really cool. I've not experimented with it myself, but it actually gauges what your level of physical capability is and then gives you ideas about what you could do for exercise at your given level. So it kind of adapts and provides you some personalized feedback, which is really important for, again, reiterating and bringing in how do we, again, get these healthy behaviors up and running. So feedback can come in lots of different forms. So oftentimes we think about it as maybe if I'm sitting across the desk from my supervisor and they tell me if I'm doing a good job or not and if I get to keep my job, right? But for fitness, right, it's a little bit different. So these could be reminders or alerts. So my watch buzzing at me every hour to get up and move, walk my, I think it's 250 steps to get it to buzz and say, good job. My reward is that little good job for my watch. It can also be some other type of reward. There's been some interesting studies where they actually pay people to exercise. Not sure how I really feel about that, because when the payment's gone, where does the exercise go? But finding some sort of reward. It could be internal, right? The reward of being able to play with your kids for a little bit longer, chase them around, whatever it might be. The more personalized feedback you can get, the better the situation. So if you're meeting with a personal trainer once or twice a week, that's an awesome opportunity to get feedback. Be honest with them about your experience of exercising with or without them over the last week, month, whatever it might be. Checking in with a primary care physician. If they don't bring it up to you, bring it up to them. So there are a lot of primary care physicians who have a lot of other things to talk to you about, and this may not be their priority. But if it's a priority for you, my watch is just buzzing for my 10,000 steps. So, yeah, right, I got it. So, anyway, I'm flailing my arms around a lot, so it's probably not real. So if your physician, right, isn't talking to you about it, but it is a priority for you, do not be afraid to talk to them that it is a priority and you want to get some feedback. Either they're going to be able to give you feedback or guide you in the direction of somebody who can give you some really important feedback. Other feedback that you might be able to get is when you're participating in exercise in a social way. So I'm a huge, huge advocate for social support when it comes to exercise, eating behavior, weight loss. It is an absolutely crucial part